This is the fourth and possibly final installment of our COVID chats, our monthly COVID chats. This month, we're focusing on the new chunk of law that just passed, became effective last Monday, November 30th, regarding safety in Cal-OSHA. And then we also are going to talk about the laws that have passed that are starting on January 1st regarding COVID and workers' compensation. And we have a special guest star, the first of our guest stars in our COVID chats, Joe DeLucchi from Cal Insurance. Cal is based in San Francisco. They've been around for what, 30 years, Joe?
No, this is 1927.
19, I stand corrected, almost 100 years. And Joe and I have known each other for about 15 years, and he's been a terrific, his firm has been a terrific partner in Next Level Strategies for that time. They are our absolute go-to for all workers' comp referrals. And I'm going to turn it over to Joe to introduce his colleague, Abe, and he's going to handle the first part of this presentation for us.
Great. Thank you very much, Julie. I see that somebody asked if there was a protocol for asking questions, and Joy had answered and alerted. If you do have questions, Julie, I know you want this to be interactive.
Yes.
So for people to unmute themselves and then ask the question, and we'll do our best to answer it in these crazy times, seeing that rules seem to be changing pretty rapidly. And, you know, what we say today might be different in a month or 2 months or 3 months, but we're going to do our best to get through it all. Yeah. So again, Joe DeLucchi, I'm president of Cal Insurance. This is I'll be entering my 6th year of presidency, so I've made it through the first 5. Abe Jabhan is with ESM, and they are a strategic partner of Cal Insurance and our clients. So when we have workers' compensation clients, and you know, claims do happen, ESM is our partner for the claim handling. And particularly what I love is that Abe and his colleagues, a lot of them are former adjusters for workers' compensation carriers. So they know the lingo, they know what to be asking about, they know the procedures, and they know how to get those adjusters to handle these claims appropriately for our clients. Because if they're not handled properly, it can have big financial impacts on the back end. So not only is there an expert like Abe and teammates of his there, but they also have claim and risk management services too. So it's just a wonderful suite of offerings for our clients, particularly as they try to grow and scale out. So let's see, who's controlling the slides here? We're on the next slide. Okay, so here's our legal disclaimer, and here we are about Cal. Cal designs insurance programs. We're advisors, right? So we work with businesses, with nonprofits, schools, real estate investment groups, and successful families across the United States. So we have 3 units. I'm on the business insurance side. We have colleagues that handle group employee benefits, and we have a private client services division that works with individuals and families. Okay, so the impact of COVID within the workers' comp system, we're going to talk about that. We're going to talk about the new reporting requirements of the Senate bill and the Assembly bill. I'm sure you guys by now have heard of these 2 bills. And then Cal-OSHA emergency temporary standard. Oh boy. Julie, we got a lot to cover here. Let's go to the next one.
All right, doing it.
Okay, perfect. So a couple of items, and one thing's just hot off the press for employers too. COVID claims are not going to be included within the experience modification calculation. So COVID claims are reportable they must be reported to the workers' compensation carrier. It's just on the lost runs, but then also the Workers' Comp Insurance Rating Bureau, the experience modification worksheet, it'll be assigned a different code. So it'll be ignored. It'll be there, but it'll be ignored. So it will not have impacts to the experience mod calculation. This number 2 here is going to be updated a little bit. So workers that are working at home right now are classified under 8810 clerical. So this is the first time in the history of the WCIRB that I know of this, where they're allowing a split. And I'll give you an example. Let's say that you are a retail showroom and the flooring, okay? And you have employees that normally are on the retail floor, you know, selling to customers, taking care of customer needs, et cetera. Shelter in place hit. And now a group of employees that used to be working on the floor maybe are working from home now, and they're fulfilling orders and so forth. there is a one time for your workers' compensation final audit where you are going to be able to split the classification code, meaning that when they were working as a retailer on the retail showroom floor, that'll count. But when they were working from home in a clerical capacity, then their workers' comp rate will significantly reduce because they're going to go under the 8810. That's the clerical class code. Now, this is new here, that there is now, as of January 1, so policies renewing on January 1, 2021, or thereafter during the policy year, there's a new class code in California called 8871. That's telecommuting. So now, because we have employees that are working remote and may work remote entirely, the Workers' Comp Rating Bureau has set a separate classification code for 8871. That's brand new to California, and it's called telecommuting. So your employees that work from home will be under that code, and that code should be less than the clerical class code. It's up to the workers' comp carriers to define how they're going to handle the rating, but from the Department of Insurance guidelines, it should be less. And I'm pretty sure workers' comp carriers will charge less for that as well. We've had 5 years, California employers that are on this call right now, of very favorable workers' compensation rates for employers, okay? Now, we were concerned, and this is again hot off the press, we were concerned that because of COVID, the 5 years where we've seen rate decrease after rate decrease after rate decrease was going to turn. That will not be the case. There was talk of having a COVID surcharge. At first, there were going to be 3 categories, and there were going to be 6 categories. If you worked in healthcare or agriculture, you'd be in the highest tier. If you were, telecommuting or a tech company, you'd probably be in the lowest tier. The commissioner rejected that. So there will not be COVID surcharges on your workers' compensation policies in 2021. So that's good. That's favorable. And the trends I'm starting to see with the carriers right now, we fully expect rates to continue to remain steady or even decline year over year. So it should be another favorable workers' compensation rate. Now, your experience mod changes things. It could change things dramatically. But as far as if you just looked at rates before the experience modification factor, they've been coming down. And let's see, wages paid to non. So this is for your final audits, again, that are coming up from the 2020 year. You furloughed folks. You had folks that you kept on payroll. You got the PPP loan, but they weren't doing any work for you whatsoever from home. You're still reporting it, but there's going to be a special classification code for that as well, where the business will not be, or the nonprofit or the school will not be penalized by having workers' compensation costs associated with employees that were still on payroll, but not working for the company. So remember those items when it comes time for final audit. So important. Shall we move to the next slide, Julie? Okay, so I think we should send the slides out later. Julie, the slides, when we first prepared it, these were all hyperlinks. So somebody could just click on it for whatever classification they were in, and it will take them to the Department of Health and Cal-OSHA industry guidance. So when we send those out, when we send the slides to participants afterwards, hopefully we can get the hyperlink back in for them.
I think they're still there.
Okay, I tried with the sample one before the meeting, and it didn't work for me, but yeah, we'll keep an eye on that.
We'll double check. Yep.
Perfect. Thank you so much. And Abe, I'm going to have you unmute yourself because I want you to join in too, because you're on the front lines of these claims the same as I am. So let's talk about the reporting of the COVID claims and what must happen. And I know we've got a few different slides. So right now on this particular slide, we're just going to talk about, it's the same as when you report to OSHA. And Abe, maybe you could interject. When must an employer call OSHA?
Thanks, Joe, and thank you for the warm introduction, and I appreciate our partnership with Cal and NLS for putting this on. It's really a time where there's so many new regulations. As you've seen, you're all in the right place for getting updated information, but we'll want to keep track of some of the information just to make sure as it updates, we're staying informed. I've seen a lot of confusion about reporting. So to your point, Joe, with regard to OSHA, you want to keep it really simple as far as, obviously if there's a death or a serious illness just generally at your work site, you're going to be contacting OSHA, and COVID's no different. The test really is whether or not, and you're going to know if they have a serious illness or injury. But for COVID, the test is really whether or not they're admitted inpatient to the hospital. So if that does occur, then that should really trigger for the employer that I need to take action. And really the common theme with all of these new legislations or laws that have passed is a triggering event that happens, whether or not it's a positive test, or you have an outbreak, or you have a serious illness. Those things all trigger different actions that you'll have to take. So with regard to OSHA, inpatient hospitalization or death, you're going to want to make sure you're contacting OSHA with regard
And you're
to that.
contacting them immediately. I mean, it's the same rule within the 8 hours of when the employer knew or should have known. And, you know, when I grew up, 22 years ago, getting started in this industry, I was kind of told, hey, if an ambulance shows up at the workplace, then OSHA should be called. That was kind of the thought pattern that I had received as a young insurance guy back in the day. It's a good reminder that COVID-19 hospitalization falls into this OSHA requirement, and the fines can be substantial if not adhered to, not just for COVID, but whenever an employee is admitted to the hospital from a serious injury due to the workplace.
Yeah, one thing I'll clear.
Does that give rise? Excuse me, I'm sorry. I've got a pretty critical question here.
Go for it.
Does that give rise to an assumption that the COVID-19 was contracted in the workplace? Are we supposed to make that distinction?
Well, now there is a slide about this, so we're going to jump. We're going to.
Okay.
We'll attack it right now, though, and then we can jump past that slide when we get there. So yes, in California, the governor has directed that it is presumed always that COVID is was received on the workplace. Now, here's a caveat. If it's a remote employee that does not come into the workplace whatsoever, that does not need to be reported. So remote employee, not reported. Abe, you're looking at me funny. Am I being wrong?
No, you're on
Okay.
you're on the right track. I do want to. No, I'm just looking at my notes because I want to clarify one thing with regard to the OSHA reporting, and then
Okay,
yeah,
sure.
Go ahead.
Sure. But to answer your question, yes, if they are in the hospital, if they have hospitalization, that must be reported to COVID. If an employee, to further answer your question, if an employee comes to you and says, I have COVID and I believe it was work related, then certainly that must be reported to workers' compensation. And then there's other steps too. If the employee comes to you and says, I have COVID, but I do not believe it happened at home. I mean, I do not believe it happened at work. My wife or my spouse, significant other had COVID. I'm pretty sure that I got that from my significant other. I just want to alert you. Hopefully they're calling you to tell you this and not in person. That also gets reported to the workers' compensation carrier, but differently. And we're going to address that in a later slide. Does that help at least answer your initial question? I hope so. Okay. We will.
Yes, thank you. It's a kind of dicey because we have some people working remotely, but only part of the time, and other times they have to come in and touch the desk. And it's a small office, so we sort of know each other. And if you've been to see your uncle in Idaho and you come back and you're quarantining at home and you get it, I'm probably not calling OSHA. I mean, because I know that you were in an area of concern and you got it while quarantining.
Okay, but again, if the employee had been at the work site and did end up in the hospital due to COVID, that still should be reported to OSHA. Just for clarification.
Right, but I'm thinking not if they haven't been in the office for 2 weeks, whatever the quarantine. If he hadn't been in the office since the time.
I would agree with that. Abe, would you agree with that?
Yeah, there's definitely a time constriction when it comes to reporting these and whether or not they're going to be presumed work related or have eligibility to be presumed work related. And one thing with Yeah,
That's a
just one
whole
thing I
different-
wanted to clarify real quick, Joe, with the OSHA reporting, it's inpatient hospitalization. So even if they're admitted to an emergency room for just observation and their discharge right away, you don't have to contact OSHA on that. But if they're admitted inpatient,
Okay.
they're checked into the hospital, that's really the indicator that, okay, this is going to be serious. And really, you're going to know whether or not
Yeah.
it moves to that status, just because COVID is a special type of illness where, if you need to get admitted,
If
it's
you
for a
crash.
serious reason.
So
Well,
there was,
and the reason I asked though is because are we supposed to file it and then fight it out as to whether or not it was a workplace event, or
we'll get there.
if we're
We'll get there in the
relatively
slide. We'll get there in the
certain?
slide.
Okay, okay. I'll stop interrupting. Thank you.
Yeah, no worries, no worries. But yeah, we won't even look at it as a fight here, and we'll explain why in a little bit. There was also another question. I just want clarification. This person wants to know: do we contact OSHA for every positive case? No, we don't contact OSHA for every positive case. Only what Abe described as far as hospitalization. Let's move on to the next slide, please. Okay, so here are the Senate Bill 159 and the Assembly Bill 685. 685 goes into effect on January 1. So 1159, and we've got more slides behind us, and I do want to keep this moving along here. We did talk about the presumption is back. There are confusing, and they continue to be updated obligations. We're going to talk about that. We're going to talk about the outbreak and then potential fine. 685 really is about alerting the staff, the workforce of a COVID case or COVID cases. So we're going to talk about that and what needs to be done. Let's continue on. Okay. All right. So what to report here? All right, Abe, let's get our work comp claims adjusting hats on here.
Yeah.
The employee comes to you and they say, I have COVID, or they call you and they say, I have COVID, but I'm pretty sure it was from my spouse because they had COVID and blah, 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 blah. Don't believe it's work reported. What is the employer's responsibility at that point?
So just to make it really simple, and to the prior point, somebody that's working on site, if they had been working on site and they test positive within 14 days of working on site, regardless of where you believe it came from, where they state it came from, that is going to trigger an obligation for you to report it as an alert to the carrier. And how you do that is what they're typically calling an 1159 form. This isn't reporting a claim, it's just alerting the carrier of a positive test, and you're keeping the information confidential. The reason that you're doing that is because 1159 has a very specific outbreak criteria. And if you meet that outbreak criteria, then they'll consider all of those cases to be presumed work related. So it's similar to the old executive order that Governor Newsom has. The difference is you're given a little bit of leeway. So if you don't have an outbreak, they're not going to presume those cases to be work related. So you really don't need to fight it, so to speak. It's just going to be automatically presumed work related, and then you can rebut that presumption assuming you meet the criteria for an outbreak. So you don't have to know what the outbreak criteria is. You don't have to know whether or not you believe a case should be denied or should be reported. It's really simple for employers. If you have a positive test, go ahead and fill out the 1159 form. If in addition to that, they allege that it's work related, regardless of whether or not you believe it's work related, but they say, I believe I got this at work, or they are asserting that they got it at work, then you're filing a claim. Your filing is normal. If anybody alleges a work related injury, even if you think it's fraud, you're going to go ahead and file a claim and let the insurance carrier do the investigation on their end.
Yes. So either way, you're reporting the claim, and the workers' comp carrier, depending on which direction employee says, I didn't get it from work, or they did, they will advise you, or you'd call, clients would call us and ask us, or they'd call Abe and ask Abe. But we're still reporting to the comp carrier that positive case, not of remote employees, but of employees that are active on the job site. And so now here's another part too. So the employee says, yes, I got COVID. I believe it was work related. I'm working on the assembly line at the factory here. And now the workers' comp carrier too needs to collect data. And the data is, where has this employee been working? If it's been multiple job sites or just one. So it needs to list what job site or job sites. And then also the highest number of employees on any given time. And that would be the employer's responsibility. Do you want to add a little bit more color to that, Abe?
Yeah, really the obligation is, when you have that positive test, they're going to be asking you a series of questions. And part of that is how many employees you have on site. And the reason that they're doing that is to see whether or not you have over or under 100 employees to figure out how big an outbreak is for your particular place of employment. For example, we have another slide on this, but if you have under 100 employees, 4 is an outbreak for this framework. For under workers' compensation, 4 would be the minimum before they presume that cluster to be work related. Now, again, you don't need to know or memorize that. You're just filling out the 1159 form, letting them know that you had a positive test, and they're going to be asking you questions like, what is the highest amount of people you had working on site within a 45-day window? And their job will be to interpret that to see whether or not they believe you have an outbreak. And when I say they, I mean the insurance carrier. So again, I know there's a lot of information here and it can seem a little confusing, but really the only thing that you have to take away from this, if you're going to take away anything, is a positive test. You're going to be filling out an 1159 form in California. If it reaches an outbreak level, the carrier will let you know what the next steps are and how they want to investigate, what other information that they need from you.
Okay, quick question, either for Abe or Joe. So it sounds like there's some questions that you need to ask an employee who tests positive. Is there like a set of questions recommended to ask? Like somewhere, some resource we could pull from?
Yeah, I mean, the CDC has guidelines on contact tracing and what they want you to take a look at with regard to the safety side of it. There's also some other notification requirements that you're going to want to fulfill that we'll also be discussing later on in the slides with regard to 685. Really, the main issue is whether or not they believe that it's work related, who they may have come in contact with. You want to be a little careful, and this gets into more on the employment law side, so it's outside of my level of expertise, but I'll say that you do want to be careful about some privacy issues. So just make sure that the types of questions you're asking,
and I would not grill the employee whatsoever. No. I would take down the info as they're letting you know. But I don't think, as far as like a set of questions, and Abe, correct me if I'm wrong, but it's not like you have to ask these 5 questions or these 10 questions. Really, it's, okay, what happened? All right, how do you believe it happened at work? Okay, let's talk about, what job sites you were at. Let's make sure we're on the same page. Really, Abe, I mean, that's, and then you report to the comp carrier, really get it into their hands, because, they'll be doing more of the question and more of the follow-up thereafter.
Yeah, your obligations are really objective, right? It's positive test equals, filling out the 1159 form. There's very specific criteria they'll ask from you. And then the carrier really is then tasked with investigating that any potential allegations or claims, or doing background of where they may have gotten it. Now, that doesn't mean the employee may not give you information that you want to relay to the insurance carrier. Perhaps they say that they were at a barbecue over the weekend. That might be material for the adjuster to know. But as Joe mentioned, I wouldn't belabor the point, because it really isn't up to you to investigate whether or not it's work related. That's going to be up to the carrier, and they're going to determine whether or not you have an outbreak based on the quantity of cases.
And the state too. I mean, and not just California, but other states. They're trying to incentivize the employer to make sure that all these get turned in, because they're like, hey, this will not affect your experience modification factor. And again, not just California, but other states within the NCCI adhere to that as well. Let's move on to the next slide, because I know we've got
one second, Joe. Stacy writes, just to clarify, if an employee tests positive but is 100% sure they got it away from work, do you still fill out form 1159?
If they're not working from home and they've been on site within 14 days of testing positive, it doesn't matter where they believe they got it. It's really hard to determine where you definitively got COVID. And that's part of the reason that they have this whole framework to make it objective. Once you hit 4, if you have under 100 employees, they consider that an outbreak, and then they'll presume those cases to be work related. The employer can prove otherwise. So they can use that evidence that they say they're 100% sure that they didn't get it at work to deny the claim subsequent after it's presumed to be work related. So
Thank you.
And hey, good news. We get to skip past this slide because we had already addressed it with the other questions.
Yeah.
All right. Okay, so let's look at the next one here. Reporting info to the workers' comp carrier. Well, again, we've already discussed this. All positive tests need to be reported. Again, if they're a remote employee, you don't need to. But if, as Abe mentioned, they've been at the workplace, then you do. And here's the 2 options again. Don't believe they received it at work. You still fill out the form. You still fill out the workers' comp carrier form, not the forms. But if they are, then you do fill out the 2 normal forms that you fill out for any work comp injury at the job site. So 3 forms if they believe it happened at work, 1 form if they don't believe it happened at work. Make it very, very simple. All right, next one. Okay, maybe we can skip past this one too. All right, well, employees, I would presume that everybody on the call has 5 or more employees. I don't know that for a fact, but we've been discussing this with that presumption. As Abe mentioned, the outbreak, 4 or more, or 4% if it's over 100 employees at a specific location. We've talked about the 14 days, and we've talked about reporting the work to the workers' compensation carrier as well. Okay, I think we can keep going. All right, Abe, now we're switching gears to January 1. And so we have something new that we need to do as an employer. And really, I think it's a responsible piece. We need to alert the employees working at that site, if it's multiple sites at that specific site, if there has been somebody that has tested positive for COVID. So there also ESM, if you are a client of theirs or a client of Cal's, there also is a boilerplate form that ESM has put together that basically is your letter. Dear, and you change it up to make it, personable to your company or insert your company name in there. But it would be a standardized letter that you would send to notify the employees that work at that particular site that there has been a positive COVID test. You're not allowed to give any personal identifiable information about, you can't say it was Bob over at HR, or you can't say, anything like that. So you have to protect them, but people hang out around the water cooler and they start to figure out what's up. I mean, it's, that's life. But the employer, just to protect yourself, obviously no personal identifiable information. Abe, do you have any color you want to add to this?
I think you covered it. This is really just, if you look at 1159 as the reporting obligations, 685 is the notice obligation. So if someone does, great way to put it. Yeah, if and this is going to start in January, so you have a little bit of time to put together whatever notice your HR puts together or use from a different resource, like Joe mentioned. We do have them. Of course, you're going to tailor it to your own business. You're going to want to notify employees of the protections in place, the fact that you're not going to retaliate against them for filing COVID-19 claims, and what benefits that they're eligible for with regard to COVID. So that gets into, sick leave and whatnot per your HR protocols.
So I do want to identify one thing, Abe, that was a question from before, not a question in this feed, but from before, which is if it's multiple sites, right? Let's pretend I'm a manufacturer. I have 4 different facilities, and one facility is in Oakland and the others are other places. The Oakland facility, I would just note if there's a positive COVID test there, I would notify the employees of that particular facility, but I wouldn't have to for my other 3. But, and correct me if I'm wrong or you see it differently, the other part though is, let's say it's a building, an office building, and there's 5 floors. Mm-hmm. And the employee on floor 2 was affected, do I have to then alert the other 4 floors? And our answer is yes, I would, because there's an elevator, there's a, you know, walkway. I mean, people are maybe going from floor to floor or what have you. So most definitely we would identify or alert all 5 of the floors. Do you see it any differently than I just explained it? Remote locations versus 1 but multiple floors.
Yeah, and I know Julie's going to go over what a qualifying individual is, effectively somebody that tests positive, and so they're not at the other sites. They're not going to have the exposure to that person unless the person is traveling to different sites. But with your example, you know, people working on different floors, I would just give it to all employees at that location, because they could be, you know, touching elevators or passing each other in the hallway. I would just be pretty liberal about, you know, giving out the notice to those particular employees.
Thank you. And qualifying individuals here, I know there was one more slide before this, Julie. We go back, but I think we've already covered it. So I just want to, oh, wait, I'm sorry. We're going forward, not backwards, I think. Backwards. I think that's all. Okay, sorry. All right, so I think we've already covered all of this. Cal-OSHA can issue a shutdown of entire workforce. I've not seen this for any of my clients happen yet. Abe, I don't know if you've seen this for any of ESM's clients as a whole.
No, and it you know, they're obviously cracking down a little bit harder. This particular bill is going to go into effect in January, so you have a little bit of time to put it all together. One thing I will say is that you're going to want to also notify the local health department within 48 hours if you do have an outbreak. And the confusing thing about this is that they have a different definition for outbreak. So we just got done talking about the workers' comp definition of 4 or more if you have 100 or fewer employees, or 4% if you have over 100. You don't necessarily need to memorize that or anything, but just know that if you do have 3 or more lab confirmed cases within a 2-week period, you're just going to want to get in contact with the local health department, and that's going to be required in January.
Question, can you hear me?
Yes.
Hi, Julie. It's Susanna. We have an outbreak, and I tried to notify them, and they tell me to just fill out a form online and send me vague general information, and they're not doing anything. Is that normal?
Yeah, it's pretty normal. I will say that they're overwhelmed, and really what it is, they're initially they were trying to do contact tracing for every single case. Now it's come to a point where they're just looking for you to send them the notification so that they can keep track for reporting purposes, keeping track of the numbers. Now, if you had a startlingly large amount of employees, you know, subject to outbreak, they might pay you a visit, or they might give you a call, or they might, you know, interview employees. I wouldn't expect that in upcoming
Abe
months.
and I have talked about this along with Anthony, who's the CEO of ESM. And it's come down to, you know, for your specific question and your experience, Susanna, do your best. Do your best as the employer. You know, you make that initial outreach, you've done everything right. You know, if they're telling you just fill out a form and go here, you've, in our mind, in our eyes, fulfilled your obligation. Let's go on to the next slide.
And
okay.
Joe, Annabelle wants to know, the health department definition of an outbreak is 3+ lab confirmed cases in what time period? What is the time period?
Oh, Abe, you had just responded to that. 14 days?
Yeah,
yep.
14 days. Yep.
Okay.
Yep.
What is the penalty for not notifying of a potential exposure? I think it varies, right? Isn't it like 18,000 for AB 685 and 10,000 for Senate Bill 1159? And then
yeah,
OSHA
and then
too.
OSHA's 5,000.
You got another OSHA. Bottom line, avoid that. Notify. Notify.
Yeah, you don't want them to visit, and they can assess different types of penalties as well. We've seen varying amounts, but if you're complying and doing a good faith effort to comply with all the new legislation, you'll do fine.
I mean, as we can see, they're already overwhelmed. It's only going to become more overwhelming. Okay, should we turn this back over to you, Julie?
All right. I don't know. Should we? No, I think we're still in workers' comp.
Oh, okay.
But I'm happy to talk about qualifying.
Yeah. Yeah, I thought you were taking it, but we can interject at any point.
I mean, it's just a high level, right? So if when somebody's a qualifying individual, there are 4 possibilities of them being qualified, right? A lab has confirmed that they have COVID. A licensed healthcare provider has, given them a COVID diagnosis. A public health official has issued a COVID-19 related isolation order, or hopefully this will never happen to anybody.
Right.
The individual has died from COVID-19.
Thanks. Okay, so I think we talked about the defense a little bit in the sense that it's really the employer's responsibility to be turning this in, and the presumption is it did happen at work. But the workers' comp carrier will do their own investigation. And so I wouldn't put on your detective hats and really grill the people as we had talked about before. I would just go ahead and turn in that specific claim. Employers should substantiate the proactive measures. I think absolutely. I mean, this is something where, a lot of our clients, and ESM has a slew of material around safety training for COVID and COVID discussions and the exposure control plan. You want to have an exposure control plan as part of your IIPPA, right? I mean, that's the very first step. And then, Abe, you still with me, buddy?
I'm with you.
Okay. Oh, you froze. Your computer screen froze.
Oh. Well, there. I'm still with you in spirit. How's that?
So yeah, we want to have the exposure control plan. We want to have a safety meeting, alerting folks in regular discussions. If you're not feeling well, stay home, maintain social distancing, wear masks in the workplace, all of that good stuff. That just has to be done. And best practices too, to have employees initial next to it and say, they've received the safety training on COVID compliance. Employers should work with the workers' compensation carrier. Absolutely. That's point number 3. Employers should not conduct medical. Absolutely. So we've discussed these items as well so far today. Okay. So how and where employees may be exposed, take proactive measures, right? So there's a lot of clients that have shared equipment, that have constrained. I mean, these are all items in here. And really what it comes down to, and Julie, I don't know if you want to add some more color here, is, and Abe and I have discussed this, do your best as the employer, right? You don't want this outbreak. You don't want this in your workforce. Do your best. And I know sometimes it's really impossible. I was just at a client, a manufacturer's job site a couple of weeks ago. And, people have specific duties along the manufacturing machines and the belts and the fulfilling the orders and putting the stamps on and the tabs on the top of the boxes and so forth. So, they're doing their best at maintaining social distance. They're doing their best at having people, spread out, at staggering the breaks and so forth. But yeah, you just got to do your best as an employer. Let's keep going if you don't mind, Julie, unless you have more color there.
No, I'm just going to say, think of all the touch points, right?
Mm-hmm.
Touch points between yourself and your customers or clients, and between your employees. What are the touch points? Like when someone hands me a pen to sign off on my credit card slip that's like not in a jar that says clean or sanitize, it's like horrifying to me. I carry my own pens around now because I don't want to touch anybody's pen. But why are we handing pens out over and over again to the same, to different groups of people? It's
right.
Bizarre.
Let's keep going. Oh, wait, sorry, you've already kept going. I was just looking at a question that came in as well.
I'm a step ahead of you, man.
Yeah, no worries. Well, and we've talked about this as well, which is that we're notifying the workers' compensation carrier. And again, if it's a workers' compensation claim, if they say it's, it happened at work, then it's 3 forms. It's the DWC1, and then it's what the employee fills out one of the forms. The employer fills out one of the forms. Well, actually, the employee and the manager fills out one, and then the COVID reporting form as well from the carrier, which kind of dovetails a little bit into the question that's been posed here, which what's the penalty for not notifying them? I'm going to presume them is the CDC of a potential exposure. No, not the CDC, just your local. I'm sorry, your local. right now they're already overwhelmed. How will they ever know? What if an employee thinks he was exposed from his wife, but then gets a test and turns out he's negative? Do we still need
Joe,
to notify?
I told Melanie privately that we'll take that question
Okay.
when NLS takes the presentation back
Okay.
over.
Gotcha.
That's a
Gotcha.
Katie and Tawny question for sure.
All right. Perfect. Let's continue on the next slide then.
Alrighty.
Okay. I think we've talked about all of this as well. I don't know if there's anything more we need to add to this slide, Julie. I think we're ahead of the game.
Yeah, and for those of you on the call, the slides are going to go out. The reason that we put this timeline together for you is so that you could keep track of all the things that you have to submit and in what order and in what circumstance, so that you don't have to take copious notes while you're trying to listen to the presentation, right? It's all here for you. Should be black and white, right? If you've got any questions, let us know after the fact, but here's your timeline.
Thank you. Okay.
Okay, I can take it from here.
Perfect.
Right on.
Okay.
Katie, before you get started, can you address Melanie's question? Because I feel like it was a Katie and Tawny question. She wants to know if an employee thinks that they were exposed from their wife and then gets a test and the employee's negative, do we still need to notify all employees? So the wife was positive, the employee's negative and has been exposed. What are we telling employees, if anything?
Nothing. You only notify employees when there is a positive case. So if the employee becomes positive, then you will notify the staff.
That's true.
Okay. Anything else related to that? Okay, so we're going to shift gears now. Many of you have probably heard about Cal-OSHA's emergency temporary standard, which is an order that was passed last Monday, November 30th, and it was met with much confusion and panic. And before we get into it, I do want to be transparent about the fact that we are still gathering information on this. It's still evolving, and we are working to get more clarity on some of the details. And so today is going to be a fairly high level summary, and we will be happy to help assist clients with questions related to this, and hopefully be able to provide templates. We're not quite there yet, but we're working on it. So this order is going to be in place for 180 days and may be extended for a longer period than that. It applies to all employers in California, regardless of their size and their location. And it applies to employers that have employees working on site in the workplace or at a location at the employer's direction. And anytime there is even one employee that has interaction with other people, this order will come into play. We recommend that everyone read the actual order thoroughly. It's long and complex and expansive and has significant impact for compliance issues. So definitely urge you to read it yourself. And then also want to mention that Cal-OSHA has promised leniency in this initial period as employers transition into compliance. Okay, so Joe already mentioned the illness and injury prevention plan, the IIPP, and this is not new, but we are mentioning it here because the ETS requires a COVID-19 prevention plan, or CPP, and it very much aligns with the current IIPP requirements, but it is specific to COVID-19. So most of you are probably familiar with the IIPP. It assesses and identifies hazards and exposures and employee training around those issues. So the CPP will do the same as it relates to COVID. So it'll be a written plan. It can be integrated into the current IIPP, or it can be supplemental to the IIPP and should include the information about the COVID-related hazards, training, and then reporting and record keeping as well.
Yeah, and that was when I spoke earlier, I mentioned exposure control plan, ECP. This is how this stuff gets so confusing because that's just one terminology that we used for it. And then here, this is CP, but it's the same thing. Exposure control plan, COVID prevention program, one and the same. It goes along with your IIPP.
Okay, and Tani's gonna talk through some of the other points now.
All right, so to keep rolling along under the new order, there are new testing requirements for employers. Employers are going to be required to provide on-site or off-site testing during work hours to employees at no cost to the employee. So it's an employer-provided test. Ideally, this takes place on site if you can get that arranged, because the employees do need to be paid for their time. And if it's conducted off site, employees also need to be paid for their mileage. So it's an added expense. So if you can, definitely try and schedule that on site. And as Joe and Abe mentioned, if there are 3 or more COVID-19 cases within a 14-day period, it's going to be considered an outbreak. And then at that point, with this testing requirement, all employees at the work site will have to be tested. And then it has to be ongoing every week until there's no new positive cases for a 14-day period. So just ongoing consecutively, so you have that 14-day window. Within this, positive cases don't just have to be limited to employees. This can also include customers, vendors, visitors, anybody that came on site. And if they alert you that they had, COVID and they came into the workplace, that still is another event of COVID in the workplace, and you have to keep doing that on-site testing every week. Additionally, under the order, there is paid sick time as part of this order. So employees who have been exposed and are, positive employees, they must be paid while they are being sent home to isolate. Unfortunately, there's not a lot of clarity here right now on whether or not Cal-OSHA had the authority to put in this requirement as part of this order. But right now, as it stands, employers need to comply. So there's probably going to be some updates here, but right now, to ensure compliance, make sure that you're paying those employees regardless of whether or not they've used up their EPSL. Right now, the employer is required to give them paid sick time off, and it is a job protected leave. They would retain their benefits and their seniority while on the leave. And this is not a one-time event. This is ongoing. It can happen numerous times, and they even call it out in the order. And that's why Katie was saying, read the order. There's some specifics in here that really have a huge impact.
Connie, Ellen wants to know, they're up there in like Sea Ranch, right? She says that in our rural remote area, she doesn't feel like testing is going to be readily available. And so if testing isn't feasible or readily available, do we have any insight yet into what our plan B is?
No, unfortunately, they just stated it is a requirement. And so you should, at this point, do your best to get yourself aligned with a testing facility so that you know what your options are. You should try and have a few options. And I get with your location where you're at. And if you can, there are some companies that will come on site. That's going to be your best bet, especially if it gets to a position where you have an outbreak going on. It's that ongoing weekly. You just want to get it set up so it's rolling and you don't have to be sending employees out, because the mileage and the time is going to really be costly for you.
Yeah, and I've got, I just made myself a couple notes. We've got a client who runs an industrial kind of medical series of clinics. I'm going to try to find out from her and another one of our contacts if they can provide. So your industrial medical clinics may be able to provide the testing. May not, we can't promise, but that's one place to look.
And then also you should check the Sonoma County Public Health Department. Typically the county public health department websites have testing sites available as links. on their website. So definitely check there because that will probably be your most up-to-date of who's available.
And then Martine, go ahead.
Oh, I was going to say quick question, which may cause a whole nother call. But if we're going to have to pay for their time, we'll probably have to go with the 2-hour minimum pay required for our employees, right? Just for show up time.
No, because they didn't show up. They're home, right?
So then they just need to track it, like
Yeah.
for going to get tested.
Oh, as far as going to get tested. So it depends on what happens, right? So if somebody, was at work and now they're leaving and it's on their way home, they'd just be, finish out the day. It kind of depends on the timing for that. But if that's all they're doing for the day, yeah.
Okay.
Yeah.
Yeah, we do reporting for work time pay in that case. Martine wants to know, is there a business size limit for both the testing and paid sick time, or is it all businesses?
All businesses,
All
yeah.
businesses.
And it'll be in the slide noted in the slides Katie went over. It's all
Right.
businesses, and they don't care if you have 1 or 1,000 employees. It is all employees getting tested ongoing every week. It's a huge expense.
And then the same thing with the IIPP, right? You all need to have that. If this is a new term for you, you need to get in contact with us or your workers' comp carrier and such to make sure that you've got that. Annabelle wants to know, we've conducted testing and submitted samples by mail through a testing company. And she's willing to share our information, their information with Katie so that we can get it out to the rest of you on the call.
Great.
Yeah, thank you. Thanks for that, Annabelle. There we go.
All right, continuing on, we're still within the new order. So the return to work criteria. So in previous chats, for those of you that had been with us, we went over the CDC guidelines. So they're still recommending 14 days for, all exposures, 10 days of isolation for a positive case. And in both situations, the return to work criteria would be that the employee must meet that timeline and also be fever-free without the use of medication for 24 hours, and all other symptoms have to be improved. However, as things are constantly fluctuating with this, the CDC put out some new guidelines. They understand that this is really difficult for employers and businesses. So they've said that they'll, shorten that quarantine timeline to 10 days if the exposed person remains asymptomatic. And again, can shorten it further to 7 days if that asymptomatic person actually receives a negative test result. However, they're truly recommending the 14 days, but you can modify that if it really isn't feasible for you to have somebody safely quarantining for the full 14 days. In addition to following the CDC though, don't forget, and the CDC now even calls it out, you have to follow your local county public health department. The guidelines for quarantine and isolation can be a little bit different per county depending on where that employee is actually working. So another piece of the order is COVID-19 related training. So part of the order is that employers must make sure that they're actively training employees on COVID-19 information as it becomes available, as well as the internal company policies that you have in place, the social distancing guidelines and protocols that you have posted at the entrance to the work site. And just make sure that you're really communicating with employees. We all know how quickly this is changing. So it also is really best practices and now mandated to make sure that you're communicating that forward to your employees. That's the only way we're going to keep everybody in the work environment safe.
So Connie, Ellen wants to know, and this is a good one for you since we just answered that for another question, answered this question for another client about 2 days ago. She says, I'm assuming we can discipline employees who will not comply with testing requirements. What if we have knowledge? Now this is tricky because this is about off-duty. So just note the off-duty. What if we have knowledge that they have not complied with quarantine and masking requirements while off-duty?
Off-duty conduct is protected. So if an employee is being flagrant and then coming into the workplace, it is one thing if you know that somebody actually has a positive test result and they are coming into the workplace and exposing your employees, that's a different scenario. And actually the situation Julie was referencing, compared to somebody that you're like, I've just heard they were at a family gathering. They're two separate things. The person being at a gathering with, multiple people, more than perhaps the county is allowing at the time, you still cannot punish or discipline the employee. Their off-duty conduct is something that you truly can't get involved with. What you can do is make sure they're following all the questions that we ask in the daily health screeners. We can also make sure that they're adhering to the county public health department guidelines and the CDC. So all of those pieces we can be pushing back on and be very forthright about what our expectations are there. Does that answer that? Any other questions there? Jules, go back one slide. I think there was one more piece maybe. Oh, no, we got it. Okay. Okay. Again, some of the regulations under the order is having a good system for communications to the employee. So make sure that you are talking with them about the prevention procedures, the testing facilities, right? What would be available to them, or if it's going to be on site. New symptoms as they're being added to COVID-19. We remember when all this started, it was kind of limited, and now those have been expanded. So keeping them up to date with that as well, so that they truly can self-screen and update you when there is a new symptom that they're experiencing. And then also communicating to your employees that there, is not going to be any retaliation. We want to keep those lines of communication open. You want employees feeling safe in coming to you and telling you, hey, I may have had potential exposure, without fear of being disciplined over that, because the whole point, again, is to keep the entire workforce safe. So you want that person communicating to you and then quarantining appropriately. That kind of goes back to your question a little bit too, Ellen. Additionally, under the order is making sure that in a situation where there is not the physical distance measures that are able to be possible within that work environment, the order actually requires employers to take a look at ventilation systems, make sure that you've improved those where you can, the filtration's actually working. Perhaps you've implemented new cleaning procedures because of the inability to make sure that everybody is staying 6 feet apart. So you don't have to put in a new ventilation system, but you need to make sure that the one you have in place is up to date and is actually working properly. I think we already pretty much went over the reporting measures pretty thoroughly. If anybody has any questions about that, I can cover it further, but we already went over this. And then record keeping, you really want to make sure that you're keeping track of all the COVID-19 cases. There could be potential for going back, especially with workers' comp, where you are looking at some of that contact tracing and just making sure that you're keeping all that information in a secured space and that not everybody has access to it, again, because it's protected information.
And then remember on the ventilation that the space, sort of not space heaters, but space, air purifiers are not super expensive. They're not all going to work for viruses. You have to check the level of the filtration system in them, but they're not that pricey. So if there isn't a way to open up a window or keep ventilation flowing, like in a bathroom, we were just chatting with a client that had a positive case, and he said, no, nobody comes in contact with anybody else at work. And I said, what about the bathroom? You only have one bathroom. He's like, oh, well, yeah, the bathrooms they come in contact with. I'm like, okay, well, and the COVID virus can be carried on the water molecules when someone flushes a toilet. So bathrooms are particularly, actually, the latest I read, can be actually quite a contagious place to be, never mind the sinks and whatever else, but the actual flushing of the toilet, sending the molecules up into the air with these super powerful toilets that some public bathrooms have, right? But there's all these air purifiers that you can get that have a virus level filtration system in them that aren't that expensive. So there is some stuff that you can do. Like Tawny said, Joe said, do your best. Just do your best.
All right. And then lastly, kind of the bottom line here with some of this, some of the penalties involved. So as Joe and Abe have talked about, some of these violations can be classified as serious, and the penalties for the violations, they really do range. So the regulatory or just your general violation can be a little more than 13K, whereas the maximum for a serious violation can be, 25K. And a repeat or willful violation can be, almost 133K per violation. So to clarify, a repeat violation is one that's found to be, substantially similar to something that already occurred within the last 5 years. And a willful citation is when, the employer knew about the violation and didn't correct it, or was aware of an unsafe condition and didn't make an effort to actually eliminate or correct that. Those, both the repeat and the willful, again, can be up to about 133K per violation. And Cal-OSHA, under this new order, they did state that any subsection within the order can hold its own penalties. So these can layer up really quickly. So as Joe was saying, just do your best to comply. Anywhere that you can, do your best, and that in good faith, right? They were saying they're going to have some leniency there. So if you're doing your best with what the information that you have, hopefully they will actually be lenient when it comes to penalties and violations.
Thank you, everybody. I appreciate your attention today.
Joe or Abe or Tanya or Katie, anything we can say to end on a positive note rather than ending penalties?
Yeah, so we were just talking and, with the IIPP and getting that in place, if you already have that in place, we do have a piece that we can add on to that to cover the CPP. So just reach out to us and we can help you get that in place pretty quickly. And go ahead and just reach out to Joy. I think she's going to be the lady leading the charge there.
Yeah, go do your best. What questions do you have that we haven't answered? There's probably some, or is it just like, poof, mind blown? And all right, Melanie says, positive note, there's a new grant for San Francisco Bay Area companies affected by COVID. It's called 86 Fund. It's in your chat, 86 Fund.
Haven't even heard of that. That's fantastic.
A new grant. There are some grants floating around, mostly in San Francisco, but some outside. From Facebook's got some grants going and some other of the bigger corporations. There is money available. There is talk about another PPP round. Hopefully Congress can get it together soon and pass something to bail, small business out. I mean, our fingers are crossed for sure. Susanna wants to know, Katie or Tani or Joe, how to report outbreaks to OSHA, Cal-OSHA. Do we have a process? Do we have a phone number we can share or get back to Susanna and the rest of the participants?
I would imagine that would be part of that CPP that Joy's working on. So we can probably get that information out pretty quickly to everybody.
Okay, cool. Good question, Suze. Anybody else questions? Do you know what to do? Go back to your timeline. So once we pass these slides out, if somebody reports a case, go back to your timeline and it will guide you through, if anybody knows next level strategies, we like our checklists. And so, we're trying to make it as easy for you to comply without us having to babysit you every step of the way as humanly possible. Go back to your timeline and keep repeating, wash, lather, rinse, repeat, over and over again. Last chance, going once, going twice for questions, either unmute or put it in the.
And my contact info is on here. I know Next Level Strategies contact info. So to the extent you have questions afterwards and just want to reach out, I'm accessible, and happy to chat with anybody thereafter.
Yeah. Joe and Abe, thank you so much for your time. Everybody, thank you so much for the great questions and the participation. We ran a little bit long. We hope you don't mind. We're trying to jam your head full of great information that you're going to need soonish. Marcus, thank you. You're very welcome. And whoever else, pop a question if you need to. Other than that, see you soon.
All right. Thank you, everybody.
Take care.
Everyone.
Bye.
Thank you, everybody.